We decided that it was really important when we were working on FGM to work with community facilitators. We wanted to, that was the model that we wanted to use. So we recruited and trained facilitators from practicing communities to work with us around FGM. And the training, we gave them very in-depth training over about 4 or 5 days, which included things like FGM and health. Joy Clark, our specialist midwife, trained them in that. They had training on FGM and the law from Project Azure, specific safeguarding training around FGM, facilitation skills training, listening skills, and also all the administrative procedures and things like that. So they're really, really skilled up and feel confident to go out into their communities. We also provide regular supervision, and we provide a quarterly support group, which is actually run by a counsellor. It's not a therapeutic support group, but it's just a safe space for them to come together and talk about what they're experiencing in their work, and so that they can also support each other about any issues that might come up with going back into their communities and talking about FGM. So then they're responsible for gathering men and women, because we have male and female facilitators. So they need to then go out into their communities and bring groups of men or women together, and then arrange a workshop on FGM. We work in partnership with Joy Clark, who's a specialist FGM midwife. And so she always accompanies the female facilitators to their workshops. And then for the male workshops, we have a male doctor who accompanies the male facilitator. We hold the workshops in women's homes so that it's a very safe space for them. So the facilitator initially may hold it in their flat. We also pay someone to cook food from the community, so they're eating really nice food, and the women, they sit and they talk and they feel very, very safe. And we've realized that this is much more effective than holding it in a kind of anonymous community hall or something like that. So we felt it was really important to have someone who was very knowledgeable about health alongside a very skilled facilitator, and they work very, very well together. We have a specific job description, and we advertise, and also people, it comes through word of mouth as well. So now we've realised that what's really important is that, as well as obviously being very passionate about the subject and having experience and bilingual, they also need to have very, very strong links with their communities so they can gather people together. There's no point just working with women if you don't also educate men about the detrimental effects of FGM. So that was number one. We knew we had to work with men, and also holding it in men's coffee shops or in places where men come anyway has worked really well. Within the training, the issue of safeguarding and child protection is paramount, and that they have to understand it, and they have to also understand that actually they may be the ones reporting on women and men that they see every day. And that has happened in a workshop where one of the facilitators organised a workshop, gathered friends of hers to the workshop, and one of the women stood up and said, well, it's up to my daughters. If they want to have it done, I'll let them have it done. And obviously we were going to report that, and we did report it. And, we had to support the facilitator, and the police had to support the facilitator also, because the woman from the workshop was furious that someone she considered her friend had reported her. But that, as a facilitator, that is their role. It's child abuse. So we're very, very, make sure that they're very clear on that. And when we interview them as well, that's one of the things that one of the questions that we ask them is, if X happens in a workshop, how would you deal with it? And if there's any hesitation at all about, if they're a bit blurred about it, especially after the training, then we wouldn't be able to work with them. Working with community facilitators is the key way to reach the communities, because they're the ones who know their communities. They've often been through the practice themselves. They know how it feels. They know the symptoms. They know people's fears, insecurities about talking about it. And so without that knowledge, it wouldn't work at all as far as I'm concerned. They are the experts. And so they are the ones who need to go and talk to their communities. It's fine for them to work alongside, a health professional. But I think their role is absolutely key to any campaign about FGM. Retention is something, it's like in any sort of job where the employment is not permanent, retention can be difficult. But we try and stay in touch with our facilitators. Sometimes they've put us in touch with other men or women that they think would be good, and also we try and recruit. We've done an annual recruitment of facilitators as well. I think the government needs to commit more. I think putting on a kind of global girl summit isn't enough. They actually need to be funding, they need to be putting programs, they need to have a strategy. Mandatory reporting, if you don't train professionals, if you don't make the training for professionals mandatory reporting is pointless. There's no funding to train teachers in FGM. So none of the teachers know what FGM is. Well, obviously some of them do, but we get inquiries the whole time from schools who want to be trained on FGM. We're no longer funded to provide that training, so we have to charge for it, and the schools haven't been allocated a specific budget. So quite often they don't have the training on FGM, yet they're expected to report children who've had FGM who are at that school. Yet how can they support a child if they haven't had training themselves? We also say if we're asked to give workshops to students at a school, we refuse to give the workshop to the students unless the teachers have been trained as well. Because if a child discloses and the teacher doesn't have any training on FGM, how can they support the child? So I think it is important to talk about it, and I think the way it's talked about has been successful, and some of the, especially here in London, some of the media coverage has been great about it and has really got it out there to people who wouldn't necessarily be reading newspapers or magazines where FGM would be written. But picking up a newspaper on the way back home and it's on the headlines, it really has kind of infiltrated people's minds. They know what it is now. So I think we do need to keep talking about it, and we need to keep talking about it in the same way, but that has to be alongside action as well, because words without action don't ever work.